Hello guys, welcome back to Dr. Hughes Academy. Today we'll be discussing the cardiac cycle. I'm sure so many of you have issues with this topic because of how you learn it. But by the end of this topic, if you don't still understand the cardiac cycle, I'll give you $1,000. Just kidding. But I'm sure you understand it. Stick to the end. What is cardiac cycle? I'm sure so many of you would have tried listening to someone's heartbeat and you heard what? Loved up, loved up. So loved up is one heartbeat. The other loved up is the second heartbeat. Now, cardiac cycle is a series of events that occurs from the beginning of one heartbeat to the beginning of what? The other heartbeat. All right. Now, let's define some terms like what? Systole. We have systole. Systole basically means what? Contraction. So we could have atrial systole, that's atrial contraction. We could have ventricular systole, that's what? Ventricular contraction. Most times when they just say systole, you think of what? Ventricular contraction, all right? Because it's most commonly used in ventricular contraction when it stands alone, right? Then we also have diastole. Diastole basically means what? Relaxation, all right? Then how many heartbeats do you think we have in a minute? How many times does your heart beat every minute? Put your answer in the comments below, all right? But now let me tell you, the heart beats 72 times every minute. So 72 beats per minute. If the heart beats 72 times every minute, how many heartbeats do you think we have in a second? That would be what? 72 divided by 60. That will give you 1.2 beats every second. So the heart beats 1.2 times every second. All right. Now, if we want to find the time it takes for one cardiac cycle to be completed, we have to invert it. All right. So it will be 1 over 1.2. That would be about 0.833 seconds per beat. Because now we inverted both of them. So we did 1 over 1.2. So you have to turn the SI unit. All right. So it's now be seconds per beat. So it's 0.833 seconds for a heartbeat. Now looking at the various diagrams over here, we'll use it to illustrate all the events. So each diagram would illustrate what? One event. All right. So for each event, we look at what happens in the atrium, what happens in the ventricle, what happens in what? The aorta. All right. And then we'll look at this graph over here discussing the pressures, the phonocardiogram, that's what the heart sound. Then we look at the ventricular volume and then the ECG. So now I want you to first bear in mind that this is the atrium. So let's say this is your atrium. This is where ventricle, and then this is where aorta. All right. So this is your atrium, ventricle, aorta. And then remember that blood flows through the atrium, like from the SVC, that's your superior vena cava and inferior vena cava, right, into the atrium, and then from the atrium into the ventricle, then the aorta. And always remember that the valves allow for what? Unidirectional flow. Okay, so blood does not move from ventricle to what? Atrium. It moves from atrium to ventricle, then to aorta, and then to where? The rest of the body. Okay. Now we're looking at the first event, and the first event has to do with what? Contraction of the atrium. So the atrium is contracting. Can you tell me what we call this event? Atrial systole, that's correct. So we'd call it what? Atrial systole. All right? Because what? It has to do with contraction of the atrium. Now, in the atrial systole, the atrium is what? Contracting. When the atrium is contracting, what happens to the pressure in the atrium? So the pressure in the atrium is increasing. All right, we have increasing pressure in the atrium because of what? The contraction. So imagine you have a ball and then you are squeezing the ball so hard, and then there is a small space through which air can leave the ball. What happens? The pressure is increasing, causing the air to what? Leave the ball, right? Now we have our valve over here. That's your what? AV valve. Okay, mind you, we also look at what happens in the AV valve and then the semilunar valve, right? So As the atrium is being squeezed, that's contracting, what happens? Blood moves from the atrium to where? The ventricle. All right. Now, before blood started moving from the atrium to the ventricle was at what? Zero pressure. All right. So the pressure was 0 millimeter mercury. And then the aorta had high pressure of a little below 120. Okay. So the pressure in the aorta is higher than the pressure in the ventricle, and the pressure in the ventricle is the same with the pressure in where? The atrium. Always remember that when one chamber is in communication with the other chamber, the pressures are what's equilibrated. All right. So whenever there is an open valve, the pressure in the atrium will be the same with that in the what? Ventricle. All right. So as the atrial pressure is increasing from 0 to about 5 or 7, depending on if this is the left or right. So let's assume this is the left, right? Because we are using aorta, all right? So let's use this the left, but whatever happens in the left happens in the way right. Now, the pressure is moving from 0 to 7, 0 to 7 millimeter mercury. What happens to the pressure in the ventricle? It's also increasing towards 0 to 7, all right? But it's increasing together because of what? The communication between the two chambers. So now we've seen that the pressure in the atrium is increasing. What happens to the volume? Blood is leaving, right? So the volume is what? Decreasing, because you're squeezing the atrium like the ball containing air. Okay. Now the volume is decreasing. Yeah, cool, right? So when the volume is decreasing, where is the blood entering? The blood is entering where? The ventricle. So in the ventricle, the volume will what? Increase. All right. So now in the ventricle, we have what? Increasing volume. What happens to the pressure in the ventricle? The pressure in the ventricle is also what? Increasing, but slowly. It's increasing as much as what? That's in the atrium, because pressure is being equilibrated since the two of them are in communication, right? So there's increase in what? Pressure. For the aorta, you know, the aorta was already at about a little below 120, all right? If it's for the pulmonary artery, is about 25, all right, 23 to 25. But let's say aorta is about 120. But the pressure in the aorta is what? Decreasing gradually, right? Because the aorta is always what? Feeding its arterial tree. So the aorta is constantly giving blood to the rest of the body. As the aorta is giving blood to the rest of the body, its volume and pressure are what? Decreasing, because now it's, pushing blood to the arterial tree, and then the volume is decreasing. The pressure is also what? Decreasing. All right. So for the aorta, we have a decreasing volume, decreasing pressure. All right. How about the valves? Remember, we already know that our AV valve is what? Open, and then semilunar valve is closed. Yeah, right? Now, the semilunar valve is closed. Why is it closed? Because the pressure here is greater than the pressure in the ventricle. All right? Always remember that what opens up a channel is when there is pressure in a unidirectional format. All right? So only when the pressure in the atrium is higher than the pressure in the ventricle would the valve open. And only when the pressure in the ventricle is higher than the pressure in the aorta would this valve open. All right? So since the pressure is higher here, blood cannot move back. So instead of blood moving back, the valve has to close, right? Because it's unidirectional. So the pressure here would close the valve. But if the pressure here is higher than the pressure in the aorta, the valve would open. So it's more like if I have one cusp here and another cusp here of a valve. Now, if the valve is like this, let's assume the blood here coming from up is greater. What happens? The valve opens. Okay? Now, if the blood coming from down is greater, what happens? The valve closes up. All right? Because of the direction of the valve, right? Yeah. So let's represent it here on this graph. Now, let's look at that of the aorta first. So the aorta was roughly a little below 120, and then it now starts what? Decreasing. All right? Yeah. And then that of the ventricle was increasing from 0, okay, from point 0. So from point 0, the pressure in the ventricle was increasing. And then also, the pressure in the atrium is increasing from point 0 as well. Because the two pressures are equilibrated, right? Yeah. Now for the phonocardiogram, Do you think we have any heart sound? Always remember that heart sounds are produced by what? The closure of a valve. So when a valve closes, there's a heart sound, right? But now, is any valve closing? No, but there's a heart sound. This heart sound is a pathology, all right? So we could have a heart sound known as S4 heart sound, all right? So this S4 heart sound is not there normally. Okay, S4 heart sound is only seen in atrial systole when there is what? A ventricular hypertrophy. So when the ventricle is hypertrophied, there will be what? A sound heard known as what? S4 sound. So let me write it here. That's S4 sound. All right. Always remember that we have our 4 like this, and then if we complete it, we have what? Ventricular hypertrophy. All right. Now that's the S4 heart sound. Then what happens for the ventricular volume? Remember I told you that the ventricle is accumulating blood, right? So the ventricular volume is increasing. All right. Now the ECG. Remember ECG is what? Electrical event. And ECG always what? Precedes mechanical event. So whenever there's electrical event, it's more like your brain is telling your hand, grab this cup of coffee. So your brain has to first give the information to your hand to grab a cup of coffee before your hand now carries out the activity. So the same way, the SA node will send electrical impulse to the atrium before it contracts, right? So the P wave over here, the P wave would have been sent earlier on, just before the atrial systole. So this is the atrial systole, all right? This is the atrial systole. So just before the atrial systole, the P wave would have been sent, all right? So we have the P wave here. Now let's look at the second event that occurs in cardiac cycle. So this, remember your atrium, your ventricle, your what? Aorta, right? In the previous one, what happened? Atrial systole, all right? Now the atrium has contracted. Ventricle says, oh buddy, I want to contract, all right? And remember, from the atrial systole, that your semilunar valve was closed, right? But remember, your AV valve, that's your atrioventricular valve, was open during atrial systole, right? Now, what happens in this stage or in this phase is that there's what? Contraction of the ventricles. And remember, the blood moves in the direction of what? The pressure, all right? So the pressure of the contracting ventricle want to push blood back into the atrium, right? But remember what I told you about the valves. So look at how the valve is pointed. All right, the valve is meant to point downwards, all right, in this direction. But remember what I told you about the valve. Whenever, in this case, we have higher pressure coming from below. So the pressure here is coming from here. That's from below. So what happened? It was open like this initially, right? So the pressure would close the valve, all right? The pressure in the ventricle would close the valve. And then what happens? The valve closes. So we have something like this. All right? I'm sure you would expect a sound, all right? A heart sound. But we'll come to that soon. Let's talk about what happens in the ventricle first, as regards the pressure and volume, right? The pressure is what? Increased. So we have increasing pressure because of the squeezing of the ventricle, right? And then, how about the volume? It's tricky, right? Blood is not moving into the aorta. Blood is not moving into the atrium. So what happens to the volume? It's constant, right? So the volume remains the same. There's no change in volume. That is why this phase is called what? Isovolumic ventricular contraction. So this is called isovolumic ventricular contraction. Why? Because the isovolumic means that what? The volume is the same. So it's contracting within a closed chamber. This ventricle is closed. So there's no what? Change in volume because blood is not moving into any chamber, right? So that's why it's called isovolumic, the same volume, contraction of the ventricle, all right? Now what happens in the atrium? Come on, tell me what happens in the atrium. What happens to the volume in the atrium? It's constant, pretty constant, right? Yeah, constant. And then, how about the pressure in the atrium? I'm sure some of you will be tempted to say the pressure is constant. The pressure is not constant. Here is why. And the pressure doesn't reduce either. Okay, let me tell you why. Because now, remember that a pressure is pushing this valve closed, right? The same pressure is still on this valve, causing the valve to budge a little, right? So the valve would now be something like this, but it's still closed, all right? So what happens when you squeeze the atrium a little, like when you just, budge the atrium a little? The pressure in the atrium would increase a little, just slightly, slight increase in what? Pressure, all right? Yeah, I'll tell you what this wave is called, but let's just continue. Slight increase in what? Pressure in the atrium, all right? Then how about the aorta? We have our aorta here. The aorta is not affected much by what's happening in the ventricle because its pressure is already high, right? So the aorta has its normal reducing volume and reducing what? Pressure. Why? Because it's feeding its children, right? So it's feeding into the rest of the arterial system. Cool. Now let's see what happens here. Okay, remember that your AV valve was closed and your semilunar valve was also what? Closed. So let's see what happens in the graph. All right. The pressure in the aorta, remember it was decreasing. Still what? Decreases. It continues to fall. Right? And then this will be represented with atrium, right? So the atrial pressure increases a little. So it increases a little. All right. Now, let me tell you what this pressure in the atrium is called. The previous one was called A wave, and this one is called what? C wave. All right. So we have an A wave like this from atrial systole, and then we have another C wave like this from where? Isovolumic ventricular contraction. All right. You know what caused the A wave in atrial systole? I know what's causing the C wave in isovolumic ventricular contraction. All right. Now, why is this wave important? Because remember that the atrium is always in communication with the venous system. So we have our venous system here. That's your SVC and IVC, right? It's always in communication with the venous system. Now, whenever there's a pressure, is what's reflected. So the pressure is reflected backwards. Let me use the black. So the pressure in the chamber is reflected backwards, all right, and recorded in where? Venous pulse, all right. So it's recorded as a venous pulse wave. That's why we have these as venous pulse waves, all right. So it's the same wave that's seen in the atrium is seen in what? Venous pulses. Let's continue. For the heart sounds, that's correct. We have what? A heart sound from where? Closure of the AV valve. All right. What's this heart sound called? It's called S1. All right. So this is the S1 heart sound, very loud. All right. Yeah. Then how about the ventricular volume? Is it increasing or decreasing? The ventricular volume is what? Constant. Okay. So we have our ventricular volume constant here. Right. And then do we have any ECG? Remember that there was a mechanical action here. So the mechanical activity was what? Ventricular contraction. So before ventricular contraction, you would expect electricity or electrical signals to have been sent to the ventricle to contract, right? So what's the signal called? It's called what? QRS complex. So we have a QRS complex. All right? The QRS complex. Okay, let me write it out. This is QRS complex. All right. So we've looked at the graph. Okay, but we did not include that of the ventricle, right? So what happens to the ventricular pressure? The pressure in the ventricle, remember we have the ventricular pressure as the red, let's say ventricular pressure, then our blue, okay, we represented blue two times. Blue would represent what? Atrial pressure. That's over here, right? And then let's change this to green. Let's change it to green. So we had something like this, right? So green will now represent what? Aortic pressure. That's pressure in the aorta, right? Cool. Now, what happened to the ventricular pressure? Remember I told you that the ventricular pressure was what? Increasing. And why is the ventricular pressure increasing so rapidly? Because if you see it, the pressure is increasing so rapidly like this. So why do you think the ventricular pressure is increasing so steeply? That's because it's contracting within what? A closed chamber. All right. So it's contracting so vigorously within a closed chamber. And it increases steeply until it meets what? The aortic pressure. And once it surpasses the aortic pressure just a little, sorry, once it surpasses the aortic pressure just a little, what happens? The semilunar valve opens. So the semilunar valve opens because ventricular pressure is greater than what? Aortic pressure. All right. Now, looking at the events that occurs here, remember that this ventricle is still contracting. All right. The ventricle is still contracting, and this valve has opened. That's the semilunar valve has opened. So now it's contracting, squeezing blood into where? The aorta. All right. And then at the same time, the pressure here has been relieved. That's the pressure in the atrium has been relieved. So let's represent our valve over here. So the pressure here has been relieved, and the atrium starts taking up blood. That's the venous blood, right? So let's see what happens in the ventricle first. What happens in the ventricle? Is pressure increasing or decreasing? That's correct. The pressure is increasing. So we have increasing pressure because the ventricle is being squeezed, right? Yeah. Then the volume is decreasing. That's cool. So we have the volume decreasing. Then how about the atrium? The atrium, remember, is receiving blood. All right. So as it's receiving blood, its volume and pressure are increasing gradually. Okay. So it's taking up blood, causing increase in pressure and increase in volume. All right. Then the aorta, come on, I'm sure you tell me that the aorta is increasing in volume. Yeah, because blood is rushing in to the aorta, right? And then how about the pressure? It's increasing, right? So we have increasing pressure as well. Remember that this valve is open, so the pressure on this one, in the ventricle, will be equilibrated with the pressure in the aorta, right? Then how about the valves? We already know that the AV valve is closed, and then the semilunar valve is open. All right. So let's represent it in the graph over here. So we have the aortic pressure that's represented in green, and then the ventricular pressure represented in what? Red. All right. So the ventricular pressure would increase like this. All right. Because the pressure is increasing due to what? Contraction of the ventricle, right? Then how about the aorta? Remember it to be equilibrated, right? So the aorta is also increasing. That's the aortic pressure. Then how about atrial pressure? In blue, atrial pressure would gradually be what? Increasing. Gradually. All right. So you will see the atrial pressure increasing. And we call this the V wave. All right. So it's recorded as the venous pulse, V wave. Okay. So let's put it here, V wave. Any heart sound? No, there's no heart sound. Yeah. So this place, no heart sound detected. And then the ventricular volume is what? Decreasing or increasing? It's decreasing because blood is leaving the ventricle. All right. So the ventricular volume is decreasing. And then any ECG? No, come on. The ECG has already been recorded. That electrical event has already gone ahead. So it's still in the spirit of what? Contraction. All right. So we have this place to be steady. All right. Cool. So what's the name of this phase? All right. Can you guess it? There is what? Ejection of blood. So we call it what? A rapid ventricular ejection. So this is a rapid ventricular ejection. Now, that brings us to the next phase, which is the what? Slow ventricular ejection. All right. Now, in this phase, what happens? The ventricle, remember that the AV valve was already closed, yeah, from previously. AV valve was closed, and the semilunar valve was open. So we have our semilunar valve open, right? Yeah. Now, in this phase, the ventricle is not contracting, all right? It has stopped contracting. So the ventricle stops contraction. Let's say there is no contraction. Remember previously it was contracting, right? So there is no contraction within the ventricle, all right? Now, what happens? Let's talk about the atrium first. So the atrium is still taking up blood from the veins, pulmonary veins or SVC, IVC, as the case may be. All right. So what happens to the pressure? The pressure is still what? Increasing gradually, and the volume is what? Increasing. All right. How about the ventricle? Remember, the ventricle is not contracting. So what do you expect? Should the ventricle increase, decrease, or remain constant? Can you guess? All right, let me tell you. The ventricle, the pressure in the ventricle is what? Decreasing. All right? Decreasing pressure. Wow. Why is it decreasing? The volume is also what? Decreasing. Why do you think it's decreasing? Despite the fact that this is not pumping blood. All right? Now, let me tell you. We still have our arterial tree over here. So these are arterial tree. And this aorta over here is a very caring mother. So it keeps on feeding its tree as it feeds its children with blood. Right? Now, the arterial tree is being fed by the aorta. So what happens in the aorta? The aorta has what? Decreasing pressure. All right. So the rate of, okay, let's say decreasing pressure and decreasing volume, right? So the rate at which the aorta is decreasing in pressure is so great. All right. So it's feeding its children or its arterial tree with blood, and then the pressure is rapidly falling. So the pressure is rapidly falling. All right, and then the pressure here is still less than the pressure in the ventricle, despite the fact that the ventricle is no longer contracting. All right, so the pressure in the ventricle is still greater than the pressure in the aorta. That's why the valve remains open, right? And then blood is still moving in the direction of what? Lower pressure. Cool. So that's the reason for all this. And then we still have our AV valve closed, and then semilunar valve what? Open. Right? So let's represent it in this graph over here. So aortic pressure is decreasing, right? And then ventricular pressure is also what? Decreasing. Okay? So we have the ventricular pressure decreasing. Remember, it's communicating since it's an open, there's a communication between the two chambers, right? Now, the atrial pressure, is it increasing or decreasing? It's increasing because it's still receiving blood, right? So the atrial pressure is increasing. Still the V wave, all right? How about the heart sound? Do we expect any heart sound? No, there was no closure of any valve, okay? So still like that. And then the ventricular volume is decreasing, all right? But it's not decreasing as fast as when we had the rapid ejection, okay? So it's decreasing slowly. That's why the curve, bends a little. And then any ECG, come on. Do you think there's ECG? Yes, there's ECG, all right? Because now, in this phase, this is the slow ejection phase, right? So this D here is the slow ejection phase. Slow ejection phase. And then in the slow ejection phase, the ventricle was not contracting. All right. So the ventricle was just like that, receiving what? Electrical signal for relaxation. All right. So in this phase, the ventricle is receiving electrical signal for relaxation. All right. What's this called? This is called the T wave. All right. Yeah, it's called the T wave. We've seen the PQRS, then we've seen the T wave, right? So I think we're done with the graph. Let's go back to the next phase. So this next phase is what? The relaxation phase. So it's what? Isovolumic ventricular relaxation. All right. So it's isovolumic ventricular relaxation. Now, remember that the ventricle has also already received what? A T wave that represents what? Ventricular relaxation. So let's remember that the T wave represents what? Ventricular relaxation. And then we said earlier that the QRS complex represented what? Ventricular contraction. And then we said that the P wave represented what? Remember, that's correct. Atrial contraction. All right, so it represented atrial contraction. Now, ventricle had already received the T wave for ventricular relaxations. Okay, so what happens? The ventricle starts to relax. All right, the ventricle starts to relax. Now, from the previous phase, we already saw that the AV valve was closed. All right, and now in the previous phase, the semilunar valve was open, right? But in this phase, the pressure is reducing, all right? So the pressure in the ventricle is reducing drastically, that it now reduces beyond the aorta and then causes the pressure or causes the valve to close, rather. So the valve has closed. Why? Because the pressure in the aorta is now greater than the pressure in the ventricle. All right, so in this phase, we can see that the ventricle has its pressure decreasing dramatically. All right, so the pressure in the ventricle is what? Decreasing. And then the volume is constant. I'm sure you will tell me constant because you had isovolumic, right? Yeah, that's correct. And then the atrium, what happens in the atrium? The atrial pressure is still what? Increasing gradually. All right? Still increasing gradually because it's getting its venous return. All right? So the atrial pressure is increasing gradually, then the atrial volume is also increasing gradually. How about the aorta? The aortic pressure, is it increasing or decreasing? Let me tell you. First, let's go over the volume. Okay, the aortic volume is decreasing gradually, right? Because it's still feeding its children as the arterial tree. All right. Now, how about the pressure? I'm sure you will tell me that the pressure is reducing because it's feeding its arterial tree, right? Well, technically, yes, but the ventricle is relaxing. When the ventricle is relaxing, remember what I told you about the bulge on the atrium when the ventricle is contracting, right? The ventricle is relaxing, and this relaxation causes, you remember it caused the valve to close, right? But now this pressure is very much decreased. Okay, the pressure is very much decreased that blood would want to rush down this way. Since blood would want to rush down this way, the pressure here around this area increases. All right, so we have the pressure increasing somewhat like this, and over here the pressure increasing a little. Okay, because now this blood wants to rush down back. All right, so some blood wants to rush back because of the dramatically reducing or drastically reducing pressure here. It will cause blood to want to rush back, but then since this valve is closed, the blood cannot enter, right? The valve is unidirectional, remember. All right, so instead, it will just cause a slight pressure here. All right, this pressure is given a name in the graph called what? Dicrotic notch. Okay, so the pressure is called dicrotic notch on the graph or incisura. All right. Now, what's happening to the AV and semilunar valve? Come on, they're closed, right? So we have our AV valve closed. Let's say AV valve is closed, and semilunar valve is also what? Closed. All right. Let's represent this on the graph. So for the aortic pressure, remember our green is the aortic pressure, right? For the aortic pressure, we have our dicrotic notch, just a little bulge, all right? So these are dicrotic notch over here, or incisura, right? Now, how about our ventricle? The ventricular pressure is steeping, right? So the ventricular pressure is going so low, going down so drastically, all right? Yeah. Then the atrium. The atrial pressure is increasing gradually as well. All right. It's increasing in the spirit of our V wave, right? V venous pulse wave, right? Yeah. So now at this point, the atrial pressure and the ventricular pressure are meeting. All right. So what do you expect? In the next phase, you know what will happen. The pressure will now cause the AV valve to open. All right. But leave that for now. We'll come to that. How about the heart sounds? Do you expect any heart sound? I'm sure you will expect a heart sound. Why? Because the seminal valve closed. All right, since the seminal valve closed in this phase, we would have another sound here. So what would this sound be called? S2. All right. Remember we had our S1 earlier, but in this one we have our S2. All right. Great. How about the volume? The volume is not changing because the valves are closed. Okay, so there was no change in volume. And then the volume, that's the ventricular volume, would be constant. All right. And then we don't have any electrical activity coming because we already had previously for the relaxation, right? So no electrical activity. Cool, right? Let's go over to the next phase. So in this diagram, we represent the next phase, which is what? Ventricular filling. All right. So this next phase would be the rapid ventricular filling. Right? So this is a rapid ventricular filling. Now, remember that I told you that the pressure here was decreasing, as the pressure here was going down so rapidly. That's in the previous phase, right? It was going down so rapidly that it went a little below the atrial pressure. All right, so what's happened? Since the atrial pressure is greater than the ventricular pressure, valve opens. All right, so this AV valve would what? Open. All right, and remember from the previous phase that the seminal valve was already closed. All right, so the valve, AV valve, has opened. What do you expect? Blood is rushing in. All right, so blood is rushing in rapidly. That's why it's called rapid ventricular filling. Remember that the atrium had already collected so much blood. Remember SVC, IVC, pulmonary vein, as the case may be. We are feeding into what? The atrium. All right, so the pressure or the volume of blood in the atrium was high already. So much blood enters the ventricle even without any contraction, any atrial contraction, right? Because once the valve opens, this ventricle is dependent, is in the dependent part. So it just falls down. All right. So for the atrium, what happens? I'm sure you tell me that the volume is decreasing, right? Yeah. The volume in the atrium is decreasing. All right. And then how about the pressure? Is the pressure increasing or decreasing? Is decreasing, right? The pressure is also decreasing. Why? Remember that there's no contraction of the atrium, right? Instead, the valve just opens for blood to pour down because this ventricle is more dependent, so it's in the dependent part, right? Yeah. Then for the ventricle, what happens? Come on, tell me the volume, is it increasing or decreasing? The volume is what? Increasing. How about the pressure? I'm sure you'd be tempted to tell me that the pressure is what? Increasing. But let me tell you something. In this ventricular filling, right? Remember that the ventricular relaxation started in the previous phase, right? That's the isovolumic ventricular relaxation. But in this rapid ventricular filling phase, the ventricle was also what? Relaxing, right? So the relaxation has not stopped. The relaxation has not stopped. So as the ventricle is relaxing, blood is still entering. All right. So what do you think? The blood wants to increase the pressure, but the relaxation wants to decrease the pressure, right? So the relaxation will be greater than the effect of the filling of the blood, right? So the effect, the filling of the blood will cause some pressure, right? So the pressure would want to what? Decrease. This arrow should indicate what? Relaxation. All right. So the ventricle is relaxing. As the ventricle is relaxing, blood is entering, right? So the volume is increasing, right? Yeah, we all agree, right? And then the pressure, is it increasing or decreasing? That's the bone of contention, right? Now, this ventricle is relaxing. The relaxation will want to cause what? Decrease in pressure. right? Relaxation wants to cause decrease in pressure, but then blood is entering, and the entry of blood wants to cause increase in pressure, right? But who wins? The relaxation, because the relaxation occurs, so much that the effects from the feeling of blood will not be much, all right? So there'll be decrease in pressure. So let's represent that in the graph. Okay, how about the aorta? Remember that the aorta was feeding its children as well. So the pressure in the aorta is decreasing. So let's say the aorta has its pressure decreasing. And then the volume in the aorta is also what's decreasing. Then we have our AV valve open and semilunar valve closed, right? So let's look at the graph. So what happens to the aortic pressure? Remember, this is aortic pressure, right? So the aortic pressure starts going down, all right? Remember, it's going down because it's feeding its arterial tree, right? And then how about the ventricular pressure? The ventricular pressure is running down as well, but not as steep as this isovolumic phase, right? So it's running down. And then how about the atrial pressure? It's running down as well. So the both of them are equilibrated, right? Now, is there any heart sound head? There is no normal heart sound anyway, but in some individuals, majorly in children, is normal. This heart sound is normal in children, and then it's seen in maybe older people, as older adults that have what? A volume overload issue. All right? So that has a volume overload issue. For instance, in patients with CCF, all right? So in patients with CCF, remember there's what? Venous congestion, right? That's congestive cardiac failure. So CCF is what? Congestive cardiac failure. So in these conditions, remember that there's what? Venous congestion. And then the volume of blood that would have been entering throughout those periods, we are talking about the filling of blood from the what? Veins into the atrium. The pressure of the volume of blood would have been much, all right? So now, the heart sound head here is due to the load of blood, all right? So the extra volume of blood, all right? So this heart sound is called what? S3. Seen in people with congestive cardiac failure, all right? Or children, it's seen in children normally. Now, how about the ventricular volume? The ventricular volume starts to increase, right? So the ventricular volume starts to increase. And then the ECG. Is there any ECG? No, there's no ECG. All right? Now let's go over to the next phase. All right, this is the last but not the least phase. And then this phase is the phase of what? Slow ventricular filling. All right? Slow ventricular filling. Now, in this phase, remember that from the previous phase, our AV valve was closed, was open rather, and then our semilunar valve was closed. So in this phase, what basically happens is that the ventricle stops relaxing. Remember in the previous phase, the ventricle was relaxing, right? Yeah, so the ventricle stops relaxing. Now, since the ventricle is not relaxing, what do you think? Remember that blood is still rushing in from here, all right? And then there's still feeding of the atrium, okay? So now basically what happens, as the blood is moving from the veins into the atrium, is moving directly into the ventricle. So blood is just entering the atrium, then into the ventricle at once, right? Now, the atrium just serves as what? Something like a conduit for blood to just flow directly from the veins into the what? Ventricle, right? So we have our atrium over here, then ventricle, aorta. So what happens in the, okay, for the aorta, you know that it's still feeding its children, right? So for the aorta, the volume and pressure are reducing, right? Yeah, come on, they're reducing. Then for the ventricle, the volume is increasing, right? So what happens to the pressure? Can you guess? The pressure would start increasing in this phase, but gradually, all right? So it will start increasing gradually. And then how about the atrium? The atrium will maintain a fairly constant volume, right? So the volume of the atrium will be fairly constant, and then the pressure in the atrium will be slightly increased, all right, because it's equilibrated with the ventricle. Now the AV valve is open and the semilunar valve is what? Closed. So remember in this phase is what? Slow ventricular filling. And by the end of this phase, we would have had 80% of what? End diastolic volume. So the remaining 20% will be contributed by what? Atrial systole in the next phase. All right. So in the graph over here, our aortic pressure, what's happened to our aortic pressure is still decreasing, right? Because it's feeding its children. Come on, you spend a lot feeding your children. And then for the ventricles, the ventricular pressure is flattening out, preparing for what? Increase. Okay, so it starts increasing in later phase, right? And then the atrial pressure follows it, right? How about the heart sound? Any heart sound? No heart sound, all right? There's no closing of any AV valve or SL valve, stuff like that. Then the ventricular volume is what's increasing. And then any electrical activity, well, no electrical activity until the end. Remember the beginning of the next phase. This next phase is what? Atrial systole. So this next phase is atrial systole. That's this phase over here. I represented it here as well. All right. So remember that it's now at the ending of this phase and then into the beginning of this next phase that there is what? Between the two phases, there is what? Electrical activity. That's your P wave. All right. To continue, then your QRS complex and the rest. Okay. So basically, the same thing repeats itself. All right. For the atrial systole, we've gone over that. Right. So we've come to the end of this lecture. And then remember that we talked about what the events of the cardiac cycle being the atrial systole, isovolumetric what? Ventricular contraction. Then we talked about the rapid ventricular ejection, talked about the slow ventricular ejection, right? And then we talked about isovolumic ventricular relaxation, then the rapid ventricular filling, and then the last one, the slow ventricular filling. I'm sure you guys enjoyed the lecture. Thank you for sticking to the end. Please do well to subscribe, put your comments below, like and share to your friends so they can benefit from this lecture. Thank you and see you in the next lecture.